The Medical Watch predicting a heart attack is both possible and affordable, even without symptoms.
And Dina Bair has more on a new way to check for the major culprit.
It's a quick scan for calcium. The inexpensive test doctors say can help motivate patients to make important lifestyle changes. That's the idea behind a calcium score.
What we're trying to detect here is the calcium that's within the coronary arteries of the heart.
So you're going to go on this scanner, you're going to be in here for about maybe 10-15 minutes and you're going to be done.
Bob Crane let us capture his scan, a low-dose CT of the chest designed to look inside the coronary arteries. The 58-year-old's family history with cardiovascular disease runs deep. His grandfather had a heart attack at 50, his father at 60.
Truly, I would much rather know than just live in this state of denial that I don't have this condition.
The more calcified plaque present, the more overall non-calcified plaque you have, and that's the dangerous type.
The non-calcified plaque is the plaque that, when you have a heart attack, the plaque can potentially rupture, clot can form on top of it and block a potential vessel.
It's been always in the back of my head, kind of thing, but I'm like, I got to get on this.
He's already made significant lifestyle changes. He dropped weight and traded a stressful career for a job at Trader Joe's.
My job entailed, prior to the job I'm in, lots of travel, lots of stress, lots of deadlines, and I got to a point where I hit a wall and I can't do this anymore. It was affecting my health and my family. I'm able to walk to work now. The job that I have now entails being active.
After the scan, North Shore University Health System cardiologist Dr. Amit Persnani read Bob's results.
All of this stuff here in yellow is actually calcium that's in one of the coronary arteries called the left anterior descending artery.
There's more here in what's called the circumflex artery, and more here in the right coronary artery.
The higher the calcium score, the higher the cardiovascular event rate. So patients who have a calcium score of 0 have a particularly low risk of having a heart attack over the course of the next 10 years. Patients who have a calcium score over 100 have a much higher risk. Patients who have over 400 have an even higher risk.
Bob's score, 440.
This is something that, it's not going to be great news for him to hear that his calcium score is this high, but at least he can use this information to really try to make a difference going forward. So as you might have suspected, we do actually see some calcium in the arteries.
Bob saw it coming.
He has the ability to reduce his risk of a cardiovascular event of a heart attack over the course of the next 10 years by really kind of employing the lifestyle changes, potentially starting a statin medication, reducing his cholesterol, getting him into ideal sort of weight category, avoiding smoking.
I'm not afraid. I'm not freaked out by any of this. It's really the resolve to get this taken care of, or at least manage it the best I can.
The coronary calcium scan costs about $50 and is designed for asymptomatic patients worried about their cardiovascular risk. We have a link on our website for more information. Back to you.